Hello everybody, welcome to Clean Smiles by Coco. Today we're going to be discussing what the day-to-day looks like for a dental assistant, literally from your dress code to your interaction with patients and the rest of your team. So stay tuned. Having good communication skills is important in every position that you may hold. Unless you literally have no human interaction, you are going to need to communicate properly and effectively. Being able to get on the phone, call a patient, explain to a patient what's going on, get on the phone, schedule a patient for their appointment or their follow-up appointment, communicate with specialty offices, communicate with the front office staff. Y'all are a team, regardless of their position and what they do up front, dealing with charts and dealing with paperwork and files and things like that. They are still a part of your team. So it's extremely important that they tell you what's going on with the schedule and with the patients, and you tell them any type of changes or any type of updates that may be happening so that the day can run smooth. As a dental assistant, it's great to have customer service experience. Any type of job, service job that you may have held, any type of sales job that you may have held prior in the past, all of that can be utilized in this setting. And although you're not a salesman, you do need to explain certain things to patients, and you need them to understand why it's important for them to listen and why it's important for them to believe the doctor and take the doctor's advice on certain things. And it's not so much money driven, it's health driven. And I think that's where a lot of the disconnect happens, because some patients assume that it's driven off of money and they just want me to do this and I really don't need this. All of the dentists that I've worked for have not been money driven. They care about your health, they care about your happiness, and they care about your smile. And so everything that they've done has been in conjunction with the patient's needs and concerns. No one wants to be talked to like you want something from them. As a healthcare provider, it is your job and your position to educate the patient on what is going to be the best for them and what is going to be the best for their health. So I respect all of the dentists that I have come in contact with, because all of them genuinely care about their patients. I've been fortunate enough to work with both male and female dentists, and the ethics and the morals have played a large role in how they present their treatments and what matters to them when it comes to their practices. And I want to continue that same theory as I go forward in my career, and I continue to be a trusted individual in a healthcare setting. As far as on a daily basis, as a dental assistant, you are going to either be sitting in one position during procedures, standing in one position during procedures, or you're going to kind of be floating in between rooms. So you will be very active. I encourage you to make sure that you are always energized as much as you possibly can. Get a nice healthy meal in the morning, or whenever you like to eat. Have healthy snacks in between, whatever type of break or getaway that you can get. Make sure you keep yourself energized and hydrated, because most times you will be floating with the dentist to each room. You may be back and forth between rooms. You are taking rooms and turning them over. That term means that you are stripping the room of all of the used instruments, any used materials, any disposable materials. I like to call it the tornado, because you're literally picking everything up in the room that was used and you're taking it somewhere else, or you're moving it somewhere else. So that's the term that I like to use for it. But everything that's disposable, of course, gets thrown away, either in the trash or in a designated biohazard bag or container. Then the instruments are taken to sterilization. So you will be in and out of sterilization all throughout your day. either taking instruments or making sure that it's organized and clean, and getting clean instruments to your operatory room. You're going to be moving a lot. You're going to be on your feet. Even, when I say you're sitting during a procedure, there are times when, if the doctor's working on a tooth, you may have to stand, and you may have to kind of plant your feet and position your body and your back in the most comfortable position that you possibly can to do your job. You definitely got to make sure that you're practicing good ergonomics and that you are not putting additional strain on your body. I am an advocate for massages and going to the chiropractor. That you're giving yourself hand massages, because your hand can be positioned in the same way for 30 minutes to an hour. You got to make sure that you're exercising your joints and your muscles. But the biggest thing that drove me to become a dental assistant was seeing how a patient could come into the office and they're either A, in pain, B, apprehensive. They're scared. They don't really want to be there. They don't really know what's about to happen. They don't know if they can trust you. They don't know if they can trust the dentist, or they've had a bad experience and they are not wanting to go through any type of pain again. So that patient walking through the door, sitting in my chair, and I'm able to help assist the doctor in making that patient believe that they deserve proper oral health and a proper smile that they are confident in, and that they aren't afraid to show, and they have, a little swag about them back. It's nothing better than feeling confident in everything that you do, but the first thing being your smile. I believe that smiles are contagious. I know it's cheesy, but I do. And I think that if you're giving someone some positive, good energy, you're going to get it back. As assistants, your appearance is important. In the office, you're going to want to make sure that you are following whatever the designated dress code is. As far as a baseline goes, you're going to be in scrubs 9 times out of 10. There's a rare occasion where I've been to dental offices and they may have on, like a t-shirt, but they'll have a scrub jacket on top of that, or a disposable lab coat on top of that. But most times you're going to be in scrubs. They ask that you have your hair pulled back. So, a style like this, in a ponytail, up in a ponytail, in a bun, just out of your face and out of the line of your patient interaction in any type of work that you have to do. So it doesn't need to be able to be suctioned up by the suction tip like that. That means that it's a hazard. It's a work hazard to you, to the patient, to the doctor, to your vision. As far as guidelines go, you're going to want to have your hair pulled back. As far as makeup and your facial appearance, you're going to want to try to keep it as neutral as possible. If you want to do foundation, it's not an issue. There is the chance of it rubbing off into your face mask, but that's the trade-off. If that's what you want, then that's up to you. I personally choose not to wear foundation to work. I will do a lash, individual strip lash. Like right now I have strip lashes on, and lip gloss, chapstick. So it's gonna be a busy day. I know that all of that time that I just spent doing my makeup that morning, and I put on my mask and it smudges my lipstick or smudges whatever, I like to just go to work. And you can definitely look nice, you can definitely look presentable, and you can feel good by having more of a neutral look. As far as right now goes, not a whole lot of people are seeing your mouth anyway. If you're following the guidelines and wearing your face mask, you're gonna have it on for the duration of the day. It's definitely up to you, however you would like to do it, but I enjoy that extra 30 minutes to an hour of not having to get up and do my makeup. Some of the basics that you will have to become accustomed to wearing. First of all, I've got safety glasses here, and safety glasses are extremely important. Some offices may provide you with some. I chose to use my own in my own holder, safety glass holder, and this is kind of similar to what the dentists will wear on their loupes, the dentist and the hygienist, what they will wear on their loupes, to just kind of wear them around their neck. So they don't have to keep up with them all day long. They're right there, convenient for them. So I really like that concept, and I liked being able to just kind of throw them on and, you know, pull them up and get to work. The importance of safety glasses is you want to make sure that you protect your eyes from any type of fluid, any type of aerosol that could be floating in the air, that could be sprayed back up. Anything can happen. And so you want to make sure that you protect your eyes. And while you're working in a patient's mouth, you are going to be down. You're going to be in there, you know. Sometimes you're going to be like face to face to the patient, like, hey, all in their personal space, you know. And so if you would like to make sure that you're protected and that the patient is protected, you're going to want to have something on your eyes to protect your eyes. I'm sure everybody's used to having the face mask on. My camera's blurring it out. Everyone's pretty much used to wearing face masks now. Someone entering the field are gonna have to get used to having it on, having to work with it on, and even when you have your safety glasses on, you're gonna wanna have to figure out what ratio of masked glasses to keep your glasses from fogging up, because sometimes you may experience some fog in your glasses, and that's just a nuisance when you need to be able to see. And you just want to make sure that you have, you know, the right amount of air ventilating. It's personal protective equipment. This is a face shield. It's a bigger face shield, but it is a face shield. You are going to more than likely be using these, hopefully somewhere in the near future. Things will kind of slowly get back to normal, but as for right now, this is going to be a part of a lot of dental employees' uniform, and this is an extra layer of protection. It protects your entire face, so any type of liquid splatter, any type of aerosol is going to be protected by this face shield. And you know, they usually come with some type of visor or some type of head attachment that allows it to securely be on your head. I just wanted to show you guys what the shield itself looks like. It's still in the plastic. It's still ready to be opened. Your days will be hot. Sometimes you're going to have a scrub top on. You may have a lab coat or jacket, or you may have an undershirt to protect your arms. You're going to have on scrub pants, closed-toed shoes, comfortable shoes preferably. You don't want to have on a shoe that's too tight. You don't want to have on an open-toed shoe. They like for you to not have shoes with any large holes in them. Dental instruments can be sharp. If one of them falls and one of them hits your foot and you have an open-toed shoe on, or you have on something similar to a Croc, it can hurt and you can injure yourself. So you are going to want to stick closer to the closed-toe shoes. I appreciate a walking shoe, a running shoe, a New Balance, Nike, any of those, Skechers. All of those shoes are extremely comfortable, and you can be on your feet all day in them, and when you get home, your feet don't ache. They may hurt, but they don't ache, if that makes sense. So that's a part of your uniform as well. When it comes to your nails, they ask that you keep them cut pretty short. Bacteria and all types of things can gather in your nails, and you are going to want to try to give bacteria the hardest possible time you can to want to stick around on any part of your exposed body. So don't make it a nice place for them to hang out. If you do like false nails, just make sure that it's at a presentable length and that it's not going to be anything that is going to cut your gloves when you put them on. So lovelies, I hope that this video was very informative. I hope I didn't talk your ear off, and I hope that you learned a lot, and I hope that you do consider becoming a dental assistant, and I hope you move forward in the process. Don't forget to like, share, subscribe, and comment, and I'll see you guys next time. Bye.